Hi, I'm Naira Ahuja. Welcome back to my channel. Today the cause is little different. The topic of the video is different. Today I have come here to Manipal Hospital to talk about the awareness about breast cancer, and I have with me.
Dr. Amit Rotha. I'm a medical oncologist working at Manipal Hospital, Bangalore.
So today I'll be asking certain questions to him because I myself don't know the answers to it, and I myself want to educate myself and to you guys also. So, sir, shall we start with the questions?
Sure.
Okay. So, as I have heard from people that so many people have been saying that it's a hereditary disease, that if your mother gets it or if anybody in your relative gets it, there are high chances of you getting a breast cancer. Is it true?
So there are many causes of breast cancer. We say about 15 to 20% of patients may have hereditary breast cancer.
Yeah.
These are the ones where the mother has it, and we test for a gene. They may have what is called as a BRCA positive gene, and then we test the children, and if they carry the gene, there is a higher risk of breast cancer. But only 15 to 20% of patients have hereditary breast cancer. The rest of them, there are other causes, which could be the various causes we talk about, the environmental factors, lifestyle factors, all the unknown dietary factors. These are a lot of factors which we don't know about. But calling it as a genetic disease is only for 15%.
Okay, so it's one of the causes, but not the major cause. So one person asked me that can the signs be confused with pre-period soreness of breast?
So sometimes, yes, confusion does arise because there are patients who have fibroadenosis where you have lumpy feeling in the breast, and during pre-periods there's pain which happens to that. But usually it can be distinguished. So sometimes you can, the person itself can feel that the lumps go away, the pain goes away,
Yeah.
and the rest of the time it's normal.
Yeah.
We know that's not breast cancer. Cancer means there's a lump which remains throughout. It may be painful, it may not be painful. So we always say don't relate cancer with breast pain.
Yeah,
It may be just a painless lump which has been there persistent, which may be growing slowly, and then it leads to other problems.
Alright. And what could be the symptoms of breast cancer that people can actually detect that okay, these are the symptoms I'm getting and it's not very normal?
So most patients who come with do not have any significant symptoms except having a lump in the breast, and that's why we keep telling just watching for a lump in the breast. Any lump which comes in which you feel it during a self-examination, or sometimes the contour of the breast is different because the lump is below that. You can actually see that there's a mismatch between the breast sizes. You
Yeah.
can sometimes see there's a nipples. One of them is being up and down. Sometimes you can see a nipple is retracted. These are the usual signs of breast cancer. Pain is not a symptom. We keep reiterating that because many times patients come with history of lumps, but which they have had for a long time. But they say, doctor, I had no pain. That's the reason I never came for a checkup.
Yeah.
So we say, don't wait for pain. The moment you have pain, you may have the tumor must have become very big. That's the reason it's causing pain. So don't look for pain. But these are the other signs we say look for that. And sometimes clear discharge coming out may also be the sign which needs to be evaluated.
Yeah.
What we say, if you see any of these suspicious signs, get yourself checked. Let a medical checkup be done, and if the doctor tells you to do a ultrasound of the breast or a mammogram of the breast, get that done, and with that you will pick up if it's there or not.
Also, I feel if you detect it early, there are high chances of saving yourself also with the long treatment. Like in the session, when I heard that people get scared that when it's a cancer, but I also feel that when he gave another perspective to it, that now you have enough time to work on it, you will actually save that person. When it comes to heart disease or anything else, the person may go just immediately, but then you have a time, and I think early detection is that's why very important.
Absolutely, that's the point. We keep repeating ourselves repeatedly for this reason. We say if you're screening or if you're doing early detection, you're catching the lump very early, and even if it turns out cancer, there are very high chances you may be in stage 1 or 2, very early stage, where the cure is very good. And in the present era, many patients in stage 1, you're not even talking of complete removal of breast. You're just doing breast conservation surgery. Even in stage 1, 2, 3 nowadays, we do breast conservation. So you're not removing the breast. Secondly, early stage patients may not even require chemotherapy. They may be so early, you may just put them on hormonal therapy.
So, as somebody asked me that if let's say they don't have it, but there may be a chance in the future they may get it. So, what are the things that a person needs to do to, let's say, maybe maintain a healthy diet or add something in your workout routine or doing something that can prevent breast cancer from happening?
So breast cancer for us is a lifestyle disease. So what we say is The genetic part you can't control. You've got that 15% we should leave. Even in those there are precaution measures we say, but the rest of them we say a healthy lifestyle. So exercise every day, avoid obesity. Obesity is a known cause for breast cancer. A healthy diet, we always say avoid red meat as much as possible. Keep it to at least possible. Processed food, ultra-processed food, these are known causes for cancer, and breast cancer is a known cause due to ultra-processed food usage. So avoid that. Good amount of fruits, salads, vegetables, all these should be there in your diet. They have a lot of antioxidant and protective effect. Moderation in alcohol, keep it as low as you can. Smoking should be avoided. So these are all healthy lifestyle factors, and these are the best ways we can prevent most of the cancers.
All right. And so, sir, there are certain questions that people have asked me personally, so I want to address that. So, there is Lakshmi who is asking that she is frequently getting pus-filled lumps in her underarms. Can it be a cause of or a sign of breast cancer?
No, I don't think that's going to be a cause of breast cancer. Usually, the underarm lumps which have pus usually are sweat gland collections which become infected sometimes, and that causes the pus formation. This probably is not related to breast cancer.
Alright. There is Prem who is asking, is it true that if one gives birth to her baby and due to some reason she couldn't feed the milk to the baby and it stores there for let's say 6 months or a year, so then can she get breast cancer?
No, that cannot cause breast cancer. So these are myths sometimes that we have, but this is definitely not going to be a cause for breast cancer.
I think right now with Google and everything being available on internet, it's a cause of too much information that we keep searching and we keep getting indulged into myths rather than actually facts. So thank you so much for clearing all the questions. Lastly, the question that I want to ask, and even I was curious to know, I didn't know before that even male can get breast cancer. So yesterday I got to know, I was shocked. So I want to know that is it true, and if it's true, then how does it happen? What is the cause for them?
So 99% breast cancer is a female disease, but in males, 1% of patients can have breast cancer. It's a very rare disease in males, but usually in males, it comes as a lump in the breast. A little bit more tricky to pick up, a little more because awareness is low. People will not want to go thinking that's nothing abnormal. But it is still a curative disease even in males. They actually do very well. The most common cause in males is actually a genetic cause. They have a BRCA mutation, and that mutation leads to breast cancer. So every male with breast cancer, we actually test for the genes to see whether they have a genetic cause for it. But the treatment is exactly the same. You do surgery, you do radiation, and they respond very well to hormone therapy. So most males with breast cancer will do well.
Alright, thank you so much, sir, for answering so many questions, and I guess I'll be able to help many people with that. Lastly, anything that you want to convey to my audience, and you want people to know that people are not aware about, any message that you would like to give?
So the message I would like to give is, don't be scared of breast cancer. Don't be scared of the word cancer. These days, we say cancer can be cured in a good number of patients. Yes, stage 4 cancer is difficult to cure, but early stage cancer, the cure rates are very good in most of the cancers in the body. It should be, try to screen for cancer. If you have a symptom, try to go in for a test early so that you catch it early. And if you catch this cancer in an early stage, the chance of cure is very good. So that's why don't get scared of the word cancer. And there are so many advances happening in the cancer field. We say this is the era where we are moving away from chemotherapy. We're talking of targeted therapies, molecular therapies, immunotherapies for cancer management. And it's it's a time where we know we can do a lot for our patients, maintaining the quality of life and improving the survival. And that's the whole purpose of trying to keep this.
Thank you so much, sir, for answering the question. Thank you so much, guys, for joining in. Please do subscribe the channel so that I can come up with more such videos, and I'll see you super soon. Thank you.